Well, thanks, Richard. It's a great pleasure to obviously be part of this. As you say, CEO of Pennine Healthcare, chair the commercial policy group with two excellent vice chairs in Michelle and also Matt, very much supported by Judith and Luella as well. I've been in healthcare for over 20 years now. I ended up, after I graduated from university, I joined a management graduate program with one of the big medtech companies, and then I've done a lot of work in different areas: anesthesia, dialysis, nutrition, some of the pharmaceutical bits over those years. And I think primarily my reason why I'm part of the commercial policy group is because I have a passion for healthcare. I have a passion for the NHS. And when I started to do work before I chaired the commercial policy group with the ABHI, you sort of meet like-minded people. You meet an organisation in ABHI where people had that same passion, and it very much got me into thinking, how could I add a bit more value through this channel?
That's great. Well, we're very fortunate to have people like yourself, real statesmen of the industry, leading our groups. Commercial policy group, wow, that covers a multitude of things, doesn't it? Just give us a sense of the kind of issues you get into as a group.
Okay, I think, first of all, if I just maybe, Richard, give you a bit of an overview of what it's about. So I think that the core sort of purpose of the commercial policy group is really to support ABHI members in enabling, I suppose, fair trading conditions so that the NHS can have a healthy supply base, patients can have access to medical technology, which really sort of supports them in protecting and improving life. And I think our overall philosophy is that if we can help the NHS with innovation, with technology, then that is a really good way to ensure that it continues to be a really healthy healthcare system, and we hope efficiently run as well.
That's great. And yeah, I think alongside regulation, that commercial aspect is amongst, well, the probably the most important things we do every day as an association. I think they always will be. Look, there's a heck of a lot of stuff going on at the moment. I don't know where to start, but maybe just tell us what are the burning issues at the moment, and maybe your priorities in the next few months.
Well, I suppose if the obvious burning issues are, we're coming through the COVID crisis now. It's been a real challenge for many of our members and many suppliers to the NHS. This also includes, I think it's 81% of suppliers to the NHS are actually SMEs. So you can see there's some real challenges about coming back online. And also some of the challenges around our cost base, for example. So you can imagine that it's becoming extremely expensive with the regulatory piece. It's extremely expensive with the real kick up in the cost of materials in bringing products in from around the world. And I think there's some of the real challenges. And if we look at then some of the priorities of the commercial policy group, I could probably split it, Richard, into two core priorities. Number one, I would describe it as operational priorities. And the operational priorities of the commercial policy group are very much focusing on the price piece that I just discussed. How can we have a fair price so that we can really operate in the UK? And most importantly, we want to provide our products to the NHS. We don't want to have to export them out if we're an SME manufacturing here. And if we're a larger corporation, we don't want to choose other markets because we feel that it's more sustainable to support those markets than the UK. So that's very important to us. I think another core part of that operational aspect, Richard, is the tendering process. Obviously, in the UK, as we know, the tendering process is drilled down to the category towers. So what we want to ensure is that that is a transparent process and that it's fair to all suppliers, both large and small. And just as importantly, there's also stuff like the catalogue management piece as well. Clearly, that's a huge aspect, takes up a lot of time for suppliers to the NHS. So you want to ensure that's correct, that they can be adjusted when required and in a timely way as well. So I think, Richard, that's primarily the operational aspect. Secondly, I would say if we call it strategic, but it's very much based on value and value-based procurement. And I think if I could just make an important point at this duration, Richard, is that certainly every single ABHI member that I have ever met has an absolute passion for improving the health of patients. They have a passion for medical technology and how through medical technology we can do that. And we are, as many of us are taxpayers, in the UK, we also have a real understanding that it's important that every single pound that is spent by the NHS is spent correctly. So value is actually very important to every single member of the commercial policy group, but every single member of the ABHI cohort that I've ever met. I think that's an important point, because we really believe that after many years of focus on price in terms of the procurement aspect, we do not believe it's sustainable for this to continue. We need to look at how we can make the NHS more efficient and stronger by looking at how our technology can create value. Create value by pushing patients through the system more quickly, either be it through daycare more quickly. How we can look at where we can care for patients and how our technology can support that. Can we move the patients from staying in hospitals, which is expensive, to being cared for in their home, which improves their quality of life? And I think for us that is very, very important. I think finally, we want to see that every single tender that goes through the system has that value aspect in play. And I think importantly, Richard, we have to be open and clear in that it's we can't just promise to the NHS that our technology will produce this value. We want to use data. We want to use real world evidence to show this. We want to work in partnership with the NHS to say, actually, let's do value gains together. So if you benefit, we benefit, and vice versa. So for us, it's really important that we deliver this message. It's really important that we say price should not be the only lever. We should focus on value. We should focus on patients getting well more quickly, through the system more quickly, be in their home more often. And for us, that is probably the core to the commercial policy group.
That's great. That's really interesting, Graeme. Thanks for that. Just maybe just one additional point on that. We're recording this first week of October 21. Revised terms and conditions have come out from the NHS. Big emphasis on sustainability. We do have a sustainability group, and we'll be which people will hear about in due course. Any thoughts on those requirements from a commercial aspect?
Yeah, I think it's a really good point. So from the 1st of April, as I'm sure most of our members know, 2022, there'll have to be a minimum of 10% social value as part of tenders. And I think from our perspective, what we're very clear about is this: we want this to be real. So we really do believe in sustainability as an ABHI and as members of ABHI and as a commercial policy group. We see it as something that morally is very, very important. But also we really see that it should be a core aspect of becoming stronger organisations by seeing sustainability as a key driver of how we perform as businesses. Now, I suppose some of the challenges are that I have seen in the past that there has been certain aspects where digitalisation, for example, using technology, supporting education, where it has become a bit of a tick box. And that's a concern that I personally have had. And we don't want it to be that. We want sustainability and social value to be tested per supplier to show that we really are investing in it. And actually, us as ethical suppliers, ABHI members, see this as a real aspect. It's going to drive our businesses, drive the NHS, and clearly make the future a lot more positive.
That's great, Graeme. That's been so great, so interesting. Thank you. Just leaves me to say thank you so much for your energy and leadership of one of our, best attended groups, and certainly one of our most active. And I look forward to speaking to you again and hearing about progress.
Well, no, thank you. And again, just for me, a thanks really to the Luella, Judith. They give us such great support at the ABHI, and also my vice chairs have been fantastic. So thank you, Richard. It's been a pleasure to do this morning. Thank you.
Good to hear. Thank you.